Pancreatic cancer is one of the most lethal cancers. Unfortunately, without effective screening, it's usually not detected until it's in its late stages.
On this week's Health Talk, we're going to tell you why a renowned actor and a noted physician have teamed up in support of pancreatic cancer research.
So stay right here on Health Talk. We're up next. Hi, I'm Dr. Eric Mazer.
And I'm Dr. Andrea Peterson.
Today we're going to talk about a very special tribute to Pamela with Jim Naughton, a devoted husband and Tony Award winner.
Also joining us is Dr. Richard Frank. He's the Director of Cancer Research for the Western Connecticut Health Network.
Well, this is an unusual show for us. Welcome to the show. Rich, welcome back. He's a regular. So Jim, maybe you could tell us a little bit how you got interested in pancreatic cancer and a little bit about your story of your wife, Pamela.
Yeah, that's how I got interested in it. Unfortunately, she developed it. In 2009, it was discovered. She was operated on down in Memorial Sloan Kettering, the Whipple procedure, which we were told was probably one of the most complex surgeries that there is. And then we discovered how and why that is true. We came home here in Fairfield County, and Dr. Rich Frank was our oncologist. I say it's our oncologist because he was taking care of Pam, but he was basically taking care of both of us. She was treated by him for 4 years, and finally, as she said to me the day she died, well, we always knew this was a fatal disease. And the reason it's such a fatal disease, and the reason we're doing what we're doing, is because although it's the number 4 cancer killer at the moment, it's slated to be, by 2020, the number 2 cancer killer in the United States, second only to lung cancer. So what we're doing is we're doing an event this May 7th at the Westport Country Playhouse. The Naughton family, my son Greg, daughter Kira, and daughter-in-law Kelly O'Hara Naughton, I like to refer to her as the mother of my grandchildren, are doing an evening of music to support and raise money and awareness of a new clinical trial that Dr. Rich can tell you about.
Rich, you want to tell us a little bit about the trial and how that you've linked up with Jim?
Right, so I'm a medical oncologist, and I take care of people who are affected by pancreatic cancer and know and have seen how it presents too late and that it's not curable. In over 85% of the 5-year survival is less than 8%. It's one of the only cancers left with a 5-year survival less than 10%.
I was going to say, Rich, you know, as Rich knows, and I think our audience may know by now, I am a medical oncologist. I practiced, most of my practice was in the more distant past, but pancreatic cancer is just one of those diseases that really has not changed very much, either the diagnosis or the treatment or the prognosis, the outcome, you know, since I started practicing in the early 80s. So it's, you know, when you see all these molecular markers and all these new drugs and seeing these big step advances in other diseases, pancreatic cancer sort of lingers there with incremental improvement. There's certainly incremental improvement, but not the kind of dramatic improvement we might expect.
Is some of the overall prognosis related to the difficulty in early detection?
Right, so I mean, to answer to your point, despite the explosion in immune therapies, targeted therapies, Jimmy Carter and all the ads on TV people see, pancreatic cancer has still not become susceptible or responsive to any of those therapies, which is to Dr. Peterson's point that because it starts early and it spreads early. It's got an aggressive biology and becomes resistant to treatment. So I basically said, you know, we're not doing enough. And at this point, it doesn't look like in the near future the new therapies are going to impact survival meaningfully. We need to do a 180 and try to look at prevention. It's not common for oncologists, and if you go to most major medical cancer centers, you know, prevention's not really big. It's not funded, for one thing. And so it just so happens that about this time there's been a lot of new literature that MRI of the abdomen can detect early pancreatic cancer in about 60% or so of those who are affected. At an early stage, if you catch it early, it can potentially be curable. Well, the rate is much higher. So that we're going to be studying those who are genetically predisposed and those who have a new onset of diabetes and meet some other criteria. So those are the two populations we'll be studying.
and see if you can pick up
Yeah.
pancreatic cancer at its earlier stage.
Jim, maybe you could share with us a little bit about what it was like to hear those words, it's pancreatic cancer, or we think it's pancreatic cancer, and
Your wife was young at that time, sort of in the best time of your life in many ways.
Yeah. Yeah, the words were, they did an ultrasound and they found a mass in my pancreas. That was like a stab in the heart. I didn't know much about it, but I knew enough to know that that was not a good thing. And then it was, on we went, and it was a trek for the next 4 years. And everything else became secondary. Over that time, we met some wonderful people, some great doctors and nurses. The nurses are everywhere that we went. Were just really spectacular. But we were fighting an uphill battle and a losing battle, because it didn't, as always happens, or almost always happens, it doesn't present until it's already stage 3 or stage 4. And what was exciting to me about this trial that Rich is doing, embarking on, is it's not just a generic kind of contribute to cancer research. He's got a specific clinical trial to try to find an early diagnosis for pancreatic cancer. And I said, well, that's something very specific. That's kind of a sexy idea. And maybe we could raise enough money to help make this thing happen. It's, relatively speaking, not that expensive a trial. I think it's going to cost about $2.8 million over 3 years. And if it could turn the dial to developing an early diagnosis for it, it could be huge, save an awful lot of heartache and gazillions of healthcare dollars.
Yeah. Did the Whipple procedure, the surgical procedure your wife had early on, is a major. It is sort of one of the big operations we all think about, big in the absolute terms, and I presume they did that at the time thinking that they were going to give her at least a chance of cure. I wonder how did Pamela react to all of this? How did she do with that kind of major surgery? Was she optimistic afterwards, or was this?
Yes, she was.
I mean, I guess one has to be optimistic.
Well, something I had known about my wife for a long time was I think she has had the highest pain threshold of any human being I've ever known. She could really take it, and she did with this. And once you're on that path, if you're in, unfortunately, this fraternity of people who are patients for a disease like this, there's really only one thing that you do. And it's the only thing I concentrated on for 4 years, which was going forward. You don't look back. There's no back to look at. You just we got to go forward. We have to do whatever it takes. At one point, after about 3 years of chemotherapy, Dr. Frank said to me, we got nothing left to throw at this, but there's a trial that she might be able to get into. It's in San Antonio, Texas. Why don't you call this number? So I called the number, and the Southern Texas Accelerated Research Technologies, START, was the acronym for this hospital. We flew down to San Antonio in August, and it was 114 degrees and blowing when we got off the plane. It was like being in a furnace, a blast furnace.
Wow.
And she qualified and got the last space in this clinical trial they were doing. So thereafter, for the next 8 months, every week, Pam and I flew to San Antonio on Tuesday. She was treated on Wednesday, and we flew home on Thursday. And by the way, there's only one nonstop per day in each direction, so we were on it. And it lasted, and it helped, and it gave us another 8 months, and then that trial stopped working.
Rich, what is it like for you dealing with a woman and a family that's so inspiring, that, dealing with sort of the fundamentals of the existential fundamentals that we deal with as human beings, and you sort of meet those up close and personal every day?
I just love Pam as a person, and I think I'm privileged to get to know the patients that I take care of. And she was just super special, and I, in so many ways, elegant, just her carriage and generous. And she was a social worker, so social workers are good people, right?
Yeah.
Absolutely.
They're the best. And so some patients make our jobs easier because they they're helpful, and there's a trust, there's a relationship. Some can make it harder. It's funny that a lot of the pancreatic cancer patients I've taken care of, I just seem to, we get more involved than maybe in other cancers. I don't know, the battle seems to be very narrowed, and yeah, we've said in the office that the disease carries the kindness gene, because a lot of the people we take care of have that quality.
Well, there's an old joke, it's almost a macabre joke, that it goes around among oncologists is nice people get cancer. But there almost seems to be a thread of truth to that. I had the same experience. You meet the most remarkable people, and it's just tragic to have to meet them in this kind of a circumstance.
And even though as physicians we're so honored to meet wonderful people, we hope that we can avoid people getting diseases like this in the future. And maybe, Rich, you can tell us a little bit more about the need for funding for research.
Yeah, well, people don't realize that only 5% of all the billions of dollars going for cancer research go to clinical trials for new drugs, for cancer patients. For screening, I don't even think it's on the map. It's so little. It all goes to lab research.
Yeah.
And so this could only happen if we had...
Is that because it's profit and drug-driven?
Yeah.
So the NIH,
Yeah.
right?
Yeah.
I saw numbers where the NIH clinical trial expenditure is like under 4%.
Yeah,
But
that's what I'm talking about.
That's where it comes from,
That's what
if
I'm
it's going to
talking
come from anywhere, right?
Yeah, so when we enroll patients in an NIH trial, it costs at least $10,000 to put a patient in a treatment trial. The NIH gives us $2,500, and that hasn't changed in 20 years.
So it's the squeaky wheel that gets the grease, and that's why we see people in the NFL wearing pink sneakers, because breast cancer has gotten
Well, it's
all the
science
attention.
is very political, and I think
Right.
people don't realize that, but it is. And also, sometimes I think you need the spark of an idea to really then generate big-time funding. So I think a trial like this, if it shows some promise, then you may see a lot more money directed into these kind of screening programs until perhaps it becomes part of our routine medical
The
practice.
thing is, and I know, once you start talking about pancreatic cancer, all of a sudden you get a lot of feedback, and you can talk about the people you've approached and how many have been affected. You don't realize how much.
Yeah.
Yeah,
I mean, it's everywhere, and every family has had some unfortunate experience with it.
Jim, there's a
maybe-
flyer go ahead, Andrew.
Maybe you can tell us a little bit about the program and the flyer that's been put out and what the significance of the bird on the flyer is.
I thought it was a good-looking bird, actually. They gave me 5 different graphics and said, "Which one do you like?" And I said, "Got to be the bird." They said, "Why?" I said, "Because I like the bird. It's great." I said, "We're going to send this to people's homes. You know, we're all inundated with things every day saying, give us money for this or that." I said, "Maybe somebody will keep this because the bird is so cool." I mean, it's a great piece of graphic art. And
It goes also with the music you're going to produce and your family. It seems
Yeah, well,
very appropriate.
My kids and I, Greg and Kira and I, have sung stuff together for years, since they were teenagers. I mean, we've done it in public. And personally, there's just nothing that's more fun for a performer than singing with your family. So we're going to do that, and we've got this other wonderful person who's been added to the family. My son Greg married this Broadway star named Kelly O'Hara, and so the 4 of us are going to be the what they call the talent with a band. In fact, it's a local band. A fellow named Chris Coogan, who plays all over here. He and my son Greg had a garage band when they were in high school together, in Weston High School. So Chris is putting together the band. We'll do a show for about 75 minutes, preceded by a cocktail party and succeeded by a champagne and dessert party. And we'll let Rich talk for maybe 2 minutes and explain to people, so we don't want a buzzkill for the show. Right?
Exactly.
And but it's going to be an entertaining evening, and hopefully we'll raise some money. We've already raised quite a bit, because there are some people that I've taken to lunch and said, "Would you like to be a sponsor of this evening?" Newman's Own is going to sponsor us, which is terrific.
That's wonderful.
And some other folks who might like to maintain their anonymity. But there are a couple of people who've already kicked in some major dollars.
That's
That's
a
wonderful.
wonderful story about something that's happening locally because of one of our
Yeah.
local citizens, and I think also sort of grassroots type research, which is just fabulous. I think it's very, very exciting and very, very important.
And moving.
And we have to go to a break, but we'll be back after this short break to talk more with Jim and Rich about Evening for Pamela.
Don't go away. We're back with Dr. Richard Frank. He's the Director of Cancer Research at Western Connecticut Health Network.
And with Jim Naughton, famous Broadway and television star, and we're talking about an event that your family is sponsoring in memory and celebration of your wife, your late wife, who died of pancreatic cancer.
Well, we're sponsoring it really to try to move the dial forward. We're doing it in support of a specific clinical trial that Dr. Frank has developed to try to find an early diagnosis for pancreatic cancer. And who wouldn't want to support something like that?
What does this mean to you and your family? I mean, how it's one thing to go through this. Some people, well, I won't even editorialize. You tell me.
Well, the reason we're doing it is because if this trial could be successful, it could really change the whole way. It could save a lot of people a lot of heartache. We know about that. We know about heartache. The other thing is, we have a particularly strong affection for Dr. Frank. Pam was in the hospital many, many times over the course of her 4 years of battling pancreatic cancer. But there was one month early on when the port that they'd installed for her to take chemotherapy had gotten infected. So we went into the hospital and they took it out and they put one in the other side. And a week later, that one got infected. So they took that out and they put a pick in her arm, and that got infected. And they put another pick in her arm. Well, about the third weekend in a row that we were in the hospital, and we got there on Thursday and we didn't get out till Monday or Tuesday. I went home on a Saturday night to feed the dog and do an errand, and I went back to the hospital about 8 o'clock Saturday night. I walk in and he's sitting in the room next to her. I go, "What are you doing here? This is your weekend off." He goes, "And didn't you have soccer games and stuff this afternoon?" He's got children. And he goes, yeah. He said, "But when I heard you guys were in the hospital here for the third weekend in a row, I just had to come back and see you." I thought that was kind of extraordinary. And so if we can be helpful, if my family can be helpful in any way in trying to shake the can and wave the flag and say this is an important thing that he's doing, we're in.
Rich, we know you are extraordinary, and clearly you've been able to help take care of extraordinary people. Maybe you can mention again what it's like to have this relationship with a family that's ongoing.
Yeah. Well, it's interesting you say that because I think one of the hardest parts of what we do, all physicians, especially those who lose patients, is you lose the families. And you become part of the families to a degree, and then you're not part of the family, but you're still, and there are those that I was so patients you're close to, and then obviously families they move on, and no one wants to keep talking about cancer, but it's helpful to me to be continually maybe connected. I think it would help all doctors, when that does happen. It's good for our souls.
I think you're right.
Speaking personally, I think there's an unusual relationship that one develops as a cancer doctor with your cancer patients. It happens at such an intense time in their lives. It's such an intense experience. Sort of all pretense is stripped. There's a lot of
significantly and intimately with the family,
and you spend a lot of time together, sort of sharing the victories as well as the defeats. Rich knows this, I found it almost too hard to go home and shed that and live a normal life outside of that. So I stopped practicing oncology largely for an emotional reason. I give immense respect to people who somehow manage to incorporate that in their life in such a constructive way.
Well, I understand that. I said to him early on, I said, how do you do this job? He's in his 40s, he's got children, he's got a family, and he's dealing with this kind of stuff all the time, day in and day out. I don't know how you do it.
So Rich, how do you do it? How do you manage taking care of really sick people?
Well, I think we try to do the best that we can. And if we give people the best that's available, we try to take some solace in that. But I want to recognize all the oncologists at our cancer center who are all very special and bond with their patients in this way. And that's gratifying. Rich Zelkowitz, Kesav Nair, George Zara, Andrew Ruskin, Preti Pathari. Of course, it takes a village to do this.
And I've been, equally impressed by the nurses who do this for their career.
Cancer nurses are amazing.
Because, they too, I think that people who haven't been through this don't realize the intimacy of those relationships that develop, and they're very real and very intense.
And oncology takes a whole team approach, the doctors, the nurses, social workers. Jim, I'm sure you and Pamela interacted with many
Yeah,
people.
and we met nurses in lots of different states over the course of those 4 years, in New York, in Connecticut, and Texas, and they were there's not such a thing as a clinker, There was a lovely young woman, a nurse, who said to Pam at one point, darling, would you like me to wash your hair? We'd been in the hospital for a few days. Pam said, oh, I'd love that. She said, okay, I'll bring the stuff in tomorrow morning. So the next morning, we got released before the nurse showed up. And 3 weeks later, we were back in the same place, in the same floor, in the same room, and the same nurse walked in. She said, I was so happy when I came in last time and I brought the stuff to wash her, but you'd been released, so that was wonderful. She said, but you know what? I still have it in my locker. Would you like me to wash your hair? Pam said, I'd love that. I mean, that's not on the job description, but that's the kind of...
But look for the other side. As a provider, as a doctor or a nurse, it's really not that great an effort that has such an impact. You remember this so fondly, Rich going in on a Saturday night. It's an effort, and I don't want to take anything away from doing that, but it's a small gesture of humanity and empathy and sympathy that means so much to the people we care for.
It does mean so much to the people that are being cared for.
And people don't feel like a number.
And Jim, you mentioned in the first half of the show that cancer doesn't happen just to the patient, it happens to the family.
Yeah.
And maybe you can speak a little bit about that.
Well, I've been on the board of directors of Paul Newman's Hole in the Wall Gang Camp for many years and worked with a lot of the children there. And this was a camp idea that Paul had because he knew a family that had a child that had cancer, and he saw what it did to the family. And he saw what it did to the child, who was basically robbed of the experience of her childhood, where it's supposed to be fun. So he created this experience. And what we discovered very early on, the camp staff, was that if a family that has a child with cancer, the family's in crisis. And that's certainly true for any family. If any member of that unit is being challenged in this way, is in that kind of trouble. And that's what it is to have cancer. You're in trouble. And so the whole family's affected, and particularly the spouses, because you're in it together. And it means an awful lot when the nurses take that extra step. And boy, oh boy, I've seen nurses really go to just great lengths to try to make someone comfortable. I guess they're called caregivers for a reason. So it does mean a huge amount. And I've had an awful lot of experience with it, unfortunately. And as I say, we never met a clinker.
It takes special people to deal with that kind of intense tragedy.
Mm-hmm.
I mean, Andrea is one. I know that she, while you're not an oncologist, I know Andrea is very focused on the effects of disease on people and palliating that aspect of disease, which in many ways is more than we can often do with our medicines.
the nurses at our cancer center were just honored by the Norwalk Exchange Club as a group, the Whittingham Cancer Center nurses, for having impacted so many people in the community, just to talk about how extraordinary the nurses are.
So, Rich, we scared everybody about pancreatic cancer. Where can people go for more information about that? Or,
About the
and
trial?
about
the
the event with Pamela?
At WCHN.org.
And there is actually a flyer available online.
Yeah, and online you can go to WCHN.org, Western Connecticut Health Network, a tribute to Pamela, and read about our event and read about the trial that we are in support of. And by the way, Rich might even, after he speaks for maybe a minute or two at our event, pull out the saxophone and play with the band.
I
Yeah,
was
that's
going to
right.
ask. That's great.
You've played with Greg's band before, right?
Yeah, a little bit.
My son's got a band called The Sweet Remains, and they played in New York, and Rich blew a little sax with the boys.
But Rich is also
Rich is
part
very
of the
talented.
local band
Yeah.
of physicians.
The Doc's band.
Known
DNR.
as what's DNR? Do not resuscitate. A little black humor with that.
Pretty good.
Great.
Okay, great. Just the last thing, Rich, is there anything people can do to prevent getting, we know you don't smoke, good appetite, I mean, good foods, you can do things for colon, maybe breast, lung. How about pancreatic cancer? Do we know any things that put people at risk for that?
Smoking, obesity, are
Living in Connecticut.
living in Connecticut has the highest rate.
Really?
Yeah.
There's a lot in the environment we don't know about, but that's why we're doing the trial.
Well, thank you. Thank
Great.
you.
So important.
Thank you so much,
Thank
Rich.
you.
Jim, thank you for coming on. Thank you
We
for
really
all you're doing.
appreciate it.
Thank you for
Pleasure.
all you're doing, Rich, for all of your patients.
So much.
That's about all the time we have for today. I want to thank our guests, Jim Naughton and Dr. Richard Frank, for coming on the show, sharing their personal stories.
We really appreciate all that they're contributing, and we'll see you next week on Health Talk.